So welcome to the Montreal General Hospital Emergency Department. My name is Jeunesse Bourgeois. I'm one of the assistant nurse managers in the emergency department. When we receive major traumas at the Montreal General Hospital, we assess them always in the same fashion. We follow the first few letters of the alphabet, or A, B, C, D, E, and F, when we're assessing patients. We intervene as we find issues, and it keeps us in an orderly fashion so that we find things in order of priority. When we start with A, it's airway. So we need to see if the patient has a patent airway and if they're breathing accurately. If we find that the patient's airway is compromised, either they're not breathing enough or they are having problems that they have blood or vomit that's into their airway, we need to intervene. We do what's called an intubation. So we will give medication to sedate and paralyze the person, and we'll pass an endotracheal tube into the mouth and into the lungs and put the patient on a ventilator. The endotracheal tube has a balloon at the end, and it will be inflated into the lungs, and we will put the ventilator on the end so that the machine will breathe for the person. Once the patient has the endotracheal tube in, we will need to put what's called an orogastric tube in. This tube is going to go into the mouth, down the throat, and into the stomach to drain out any liquid that is coming from the patient's stomach so that they don't vomit it up into their lungs as well. Once the person's intubated, the machine's breathing for them. However, we have to make sure that the lungs are expanding properly. Trauma to the lungs can break ribs. It can actually put a hole into the lung and create what we call a hemothorax or a pneumothorax, which is where we have blood going or air going between the lung and the chest wall, and now the lung is not expanding properly. So when we have to do that, we need to put what's called a chest tube in. So the doctors will be actually cutting the skin and the muscle between the ribs. They will be spreading the tissue apart, and they will be passing a tube in the hole that's been created between the chest wall and the lung. So this has holes in it so that the blood and the air can be drained. It will be sutured into place, and then it will be hooked up to what call we a pleurovac, which we will hook up to suction on the wall. And so the tubing goes to the chest tube, and then this system will drain the blood and the air into here. So it will fill up as we go. For C, circulation, we need to see if your heart is pumping effectively and if we have anything that's causing circulatory compromise. So we're going to be looking at your blood pressure. We need to also probably give blood transfusions. And to do this, we need to make sure that we have what we call 2 large bore IVs if we can. Large bore IVs will flow very quickly. Often when you're getting blood tests, we're using very small needles. We, however, need to give a lot of fluid very quickly. So we're going to be using 14 or 16 gauge IV catheters, and we will have to put them in your arms. So this is a 14 gauge catheter. As you can see, it's quite large, and we can give lots of fluid quickly in that. We can give multiple liters of fluid per hour. And this is a 16. It's a little bit smaller, but it's also quite large as well. So we will put 2 of those. If we cannot get IVs in, we have 2 other options. We can do what's called a central line, where the doctors will pass a large catheter into a large vein, either like under your clavicle, the outside of the neck, or into your femoral veins. And this is something that we call a MAC line. It's very large as well, and the doctors will pass this into the large veins to do a central line so that we can give lots of blood products quickly. Our other option is called an interosseous, and this is actually a needle that's going directly into the bone to be going into the marrow. So we will either go into the humerus or into the tibial plateau, so just below your knee. And so it's a little gun, it's a needle that we will actually drill in. If we have uncontrolled bleeding in an extremity, so your arms or your legs, we'll probably need to use a tourniquet. So a tourniquet we are going to put on, we're going to tighten it and actually cut off blood flow so that you're going to stop bleeding. Pelvic fractures in often car accidents or falls, they can do what's called an open book fracture where the whole pelvic ring is open, and that can actually bleed a lot. And so we have to do what's called a pelvic binder. The pelvic binder will go around the person's pelvis, and we will tighten it with these strings to actually bring that pelvic ring that's been disrupted back together to create pressure and to just keep it from moving while we're doing our procedures and what we need to do. At the Montreal General Hospital, we have also one other procedure that we do when people are bleeding heavily below their diaphragm. We call it a ROBOA. This is something that we brought in a couple years ago, where we actually will insert a catheter up the femoral artery into the descending aorta, and we will inflate a balloon to cut off all circulation below the diaphragm or into the pelvis, depending on where we position the balloon. And that will give us time to get the patients to the operating room to control the bleeding at that time. We continue down to disability. We need to know, does the patient have spinal cord injuries? Are they able to move all their extremities? You'll come in with what they call a cervical collar on your neck, and that's to make sure that if you have any fractures in your neck, that you're not moving it too much to make those fractures actually paralyze you. We will continue on. We want to know, are you able to move all of your extremities? We will be having to do a log roll to make sure that we see the back as well. So the log roll, we are going to be turning everybody. We do it all in a team so that we can examine the entire back and see if there's any injuries that we haven't seen from the front, and to make sure that the spine is all intact as well. From there, we'll often have to put the patient on a board to be able to get them moved easily within radiology. But also, when we're doing our exam, the doctors will have to do a rectal exam, and that's to check if you have spinal cord injury that is creating that your nerves are not all intact, and if you have sensation everywhere. We also wind up needing to put in a catheter to drain the bladder, and so then the catheter is threaded up the urethra into the bladder. So in a male, you would take the catheter and it will go up the penis to be able to go and drain all the urine out of the bladder. When we get to E, it's exposure. We need to make sure that we're seeing all the injuries. We're going to be cutting off all of the clothing that the patient is wearing. We're going to have to get them down completely, including the underwear, to make sure that there's no injuries that we've missed. We need to see if there's any bleeding, any deformity, any bruising that we haven't seen. If you've fallen on something, we don't know if maybe there is something that's penetrated. We need to be able to expose and get all of the injuries viewed. We are going to be able to cut off all the clothing, but then we will put warm blankets on to be able to make sure that the person's not completely naked. When we get to F, we're nearly done our trauma exam. F, we're making sure that we have all of our vital signs done, that we have done a full exposure, and that we've done a full head to toe exam. But F also stands for family. We need to see if this person has family around. Have the police officers contacted family, or do we need to do it as well? One of our big challenges often is that when people come in confused, they can't necessarily tell us who we should be calling, where their family is. Often when people are young, their parents are waiting for them to come home, and we need to see how are we making sure that these families are aware that their loved ones have been in an accident and they're brought to the hospital. So please consider when you're coming in, it's always a good idea to put your emergency contacts in your phone, have it that we can reach somebody as well if you're unable to tell us.